Medicare may seem like a maze when you first try to navigate it. After all, there are different parts to the federal health insurance program, which provides coverage for about 56.5 million individuals in the 65 and older crowd. And, whether you're reaching the eligibility age of 65 or you are older and switching from workplace insurance to Medicare, there are some important factors to consider that affect your wallet. First, however, it's worth knowing the basics. Original Medicare consists of Part A, hospital coverage, and Part B, outpatient care. More from Investor Toolkit. 3 tips for paying down your credit card balances. Democrats call for action on Social Security reform. Investors are flocking to green energy funds. Some beneficiaries choose to get those benefits delivered through an Advantage plan, Part C, which typically includes prescription drug coverage, Part D. Others stick with original or basic Medicare and, possibly, pair it with a standalone Part D plan and a so-called Medigap policy. Here are 3 key things to be aware of as you prepare to enroll. 1. It's going to cost you. Medicare is not free. This comes as a surprise to so many beneficiaries who have paid payroll taxes throughout their working lifetimes and assumed this would mean Medicare would be paid up by the time they turned 65, said Danielle Roberts, co-founder of insurance firm Boomer Benefits. Those taxes will mean no premiums for Part A, but Parts B and D have premiums that beneficiaries pay monthly throughout their retirement years, Roberts said. Premium-free Part A is available as long as you have at least a 10-year work history of paying into the system via payroll taxes. If not, monthly premiums could be as much as $499 in 2022, depending on whether you've paid any taxes into the Medicare system at all. Spouses without their own work history may qualify for premium-free Part A as well. Part A also has a deductible of $1,566, which applies to the first 60 days of inpatient hospital care in a benefit period. For the 61st through 90th days, beneficiaries pay $389 per day, and then $778 per day for 60 lifetime reserve days. Meanwhile, Part B's standard monthly premium is $170.10 this year. However, some beneficiaries pay more through income-adjust surcharges. Many of my high-income earners are shocked at how much Medicare premiums will cost them in retirement, said Elizabeth Gavino, founder of Lou & V. Gavino and an independent broker and general agent for Medicare plans. The government uses your tax return from 2 years earlier to determine whether you'll pay extra. To request a reduction in that income-related amount due to a life-changing event such as retirement, the Social Security Administration has a form you can fill out. Part B also has a deductible, $233 in 2022. Once that's met, beneficiaries generally are responsible for 20 USD off covered services. Part D premiums, deductibles, and copays depend on the specifics of the coverage. The average premium this year is about $32, according to the Centers for Medicare v. Medicaid Services. And, as with Part B, higher earners are charged extra through IRMAAs. 2. Missing key deadlines can mean paying extra. If you're planning to sign up for Medicare as soon as you're eligible at age 65, you get a 7-month initial enrollment period that starts 3 months before the month of your 65th birthday and ends 3 months after it. Meanwhile, if you delayed signing up at age 65 because you continued to work and your employer coverage was acceptable, according to Medicare standards, you get 8 months to enroll once your workplace plan ends. Regardless of the enrollment rules you're subject to, missing the deadline to sign up for Part B can result in a life-lasting late enrollment penalty. For each full year that you should have been enrolled but were not, you'll pay 10 USD off the monthly Part B standard premium.